How does collaborative care billing work?
There are three CPT codes that are used in collaborative care. We have 99492, 99493, and 99494. These are time-based codes, so they are directly related to the amount of time that the behavioral health care manager, or in our case, the pain recovery coaches, are spending with the patients. So the way it works is at the end of each month, we would aggregate all of the data that would supply you the information needed in order to submit the claim or submit the bill. So that would include the patient's name, date of birth, and how many of each code needs to be billed based on the time that that patient spent with the pain recovery coach. 99492 is specifically used for up to the first 70 minutes in the patient's first month. 99493 is used for every subsequent month, so months 2 and forward. And that code is up to 60 minutes. And 99494 accounts for any extra time over in the first month 70 minutes or in the second month 60 minutes. And typically what we try to achieve is we have the patient spend up to 2 hours of time with their pain recovery coach in a month.
How do I know if these codes are covered under our payer contracts?
So that's a great question. Basically, these three CPT codes that we use for collaborative care are already in the standard fee schedule that you have with the payers that you're already contracted with. For example, if you partner with Anthem and Aetna, these codes would be already included in your existing contracts. So it's just a matter of going to those contracts and looking at the fee schedule to see what the reimbursement rate is. So you would just be leveraging your existing contracts. And then what we would do is provide you with all the information you need to submit the claim to each of the payers.
What is the cost to the patient?
The cost to the patient is really just their copay or their coinsurance that they typically pay. So in collaborative care, if a patient has a copay of, let's say, $25, they would just pay that $25 for each month that they're enrolled in the program.
What are the diagnosis codes?
So the diagnosis codes that we find to be used most frequently are F4541, which is a pain disorder exclusively related to psychological factors, and F4542, which is a pain disorder with related psychological factors.
How much extra can I expect to bill through this collaborative care model on average?
We've found that for a single provider that has a patient panel of about 1,000, with a conservative estimate that 25% of those patients will have chronic pain, we found that a provider can bill an extra $72,000 per year.